Hello, this is the Provider Certification Plan of Enhancement Overview. This session will give you a basic understanding of Plan of Enhancement and the purpose and how to complete a provider response. What is a Plan of Enhancement? A Plan of Enhancement, or also known as a POE, is comprised of multiple factors of different kinds of reviews that the Division of Developmental Disabilities does throughout a 2-year certification cycle, including a monthly file review, a policy review, Department of Health inspections, documents and procedures reviewed during on-site policy implementation visits, and as well as file reviews for community training services and targeted file reviews for elements that have not been reviewed per the monthly file review as part of the monthly file review sample. Why is a plan of enhancement required? Per our choices and family support waivers, all issues discovered through separate components of certification must be addressed on an individual level. What that means is that we have to have remediation specific to a participant's file review. During monthly file review processes, we need to see remediation of a specific policy, which doesn't include required content or meet the Division of DD standards, and remediation of specific issues when policies are not implemented as written and or implemented in compliance with administrative rule or waiver authority. The Plan of Enhancement identifies trends found throughout the certification cycle, which is 2 years, and pulls them all together into a Plan of Enhancement. Any element falling below the 86% accuracy rate is identified to be a systemic issue within the organization and has to be addressed on a broader scale. What that means is, so the 86% accuracy rate really reflects a sum of all of the factors, all of the files, all of the locations that were inspected. If there's a particular element that does not meet, that is not accurate, at least 86% of the time, that is identified and considered a systemic issue. So the timeline for creating a Plan of Enhancement. So the creation of the Plan of Enhancement is the role of the Division of Developmental Disabilities Program Specialist, which is assigned to the provider organization. Typically that is completed no later than April 1st of each fiscal year for providers who are undergoing the certification process and whose certification will expire on May 31st of that given year. Due to COVID-19, in 2020, our timelines were revised. We extended certification through August 31st, which means that we had a deadline for program specialists to create the Plan of Enhancement by June 30th. And we'll talk a little bit more about the provider timelines to draft a response and submit that to the Division of DD. Once the Plan of Enhancement has been created, the program specialist contacts their assigned provider or providers when it's been created, and a notification also appears in the Smart Message Center for the person or persons who have administration privileges within the SMART system. What is included in the Plan of Enhancement? So for waiver, we have choices waiver assurances are included. And for those providers who also offer Family Support 360 waiver services, there are also Family Support 360 waiver assurances included. Those assurances break down into health and welfare, which is reviewed during file review, service planning, which is also largely reviewed during a monthly random representative sample of files. Qualified provider policy implementation, which is traditionally the on-site review that we do. When we come on site, we look at staff orientation, training files, background checks, etc. It also includes inspections, which the Division of DD contracts with the Department of Health to ensure compliance with life safety codes, and they conduct that portion of the reviews for us for each provider biannually. Each assurance is broken down into various elements. So an example would be within the health and welfare element, abuse, neglect, exploitation, participant training is one element, safety is another element, and other rights restrictions are yet another element within that waiver assurance. We essentially look at the total number of the total sample reviewed for any given element, and compare that with how many were correct, how many were deemed incorrect, and that helps us calculate the accuracy rate. This is all done automatically within the SMART review system. And so, DDD really monitors to make sure that our data is accurate, and we look for outliers and any citations or inaccuracies that might seem a bit off or odd that we want to double check on and make sure that that was reviewed correctly and will give us the most accurate data possible. So once the plan of enhancement is created by the program specialist and the notification shows up in the Smart Message Center, the provider must respond within 30 calendar days and draft required action steps and goal accuracy rates, excuse me. Again, the revised timelines for 2020 due to COVID-19, so provider responses were due largely on July 30th. So provider comments, this is one portion of when in the plan of enhancement within the SMART system, there's a section to add provider comments. This is intended to capture the overall action taken to address the deficiency. Causal factors, so you can click on plan details, you can also click on causal factors, and that really provides a better breakdown of which causal factors within each element were cited and how many times, to help the provider identify which key issues might need to be addressed organizationally. Provider response. So there's also a text box to enter goal accuracy rate. Again, because the threshold within each of DDD's waivers is 86%, your goal accuracy rate must be at least 86%. And we recommend that that is higher than the minimum requirement. A goal date must be provided. And the goal date is really a date by which all corrective actions are expected to be completed. And we'll talk about each corrective action in just a moment. This goal date might be any time between the date the plan of enhancement was created and the next certification expiration date. The goal date shouldn't precede the last completed by date in the actions section. So as we look at the action section, we have, moving from left to right, we have the method, we have the action taken and completed by. So under method, this is really an indication of which kinds of approaches are planned or have been implemented to address the systemic issue. The action is a brief description that really should have a clear connection to the element, the causal factors that were cited, and the corrective actions listed. So for example, a policy revision. So if policy revision were checked, you would see an action outline that said something to the effect of policy will be revised by CSP management, reviewed and approved by board of directors and DDD. For staff training, you might see something to the effect of all DSPs will be trained on the revised policy. Completed by, and this differs from the goal date because this is the date by which each specific action is anticipated to be completed. So once the provider has completed all of these steps for each element, they will click the provider completed box, which you can see in that little screenshot at the bottom of the screen. There's a checkbox to be completed. That notifies the DDD program specialist that the plan of enhancement is ready for their review. Once that checkbox is checked, there can be no more edits by the provider. So DDD has 15 days to approve the plan of enhancement once that provider completed checkbox is marked. Program specialists will follow up with the provider within those 15 days with any questions or recommendations or concerns with the content of the plan of enhancement. And once approved, the provider will receive a notification in the Smart Message Center. Again, that is triggered by the program specialist clicking in the POE approved checkbox. And you can see that within the red circle there on the screen. Monitoring the plan of enhancement is the next step once the plan of enhancement has been approved. So periodically, program specialists conduct check-ins with their assigned providers throughout that certification cycle to discuss progress towards meeting compliance, towards their goal rates, and also discuss any barriers to attaining that compliance for each element that's included in the plan of enhancement. Notations are made in the state comments section of the plan of enhancement with each periodic check-in, and program specialists are available to offer on-site or virtual technical assistance. We're also available to connect providers with other expertise and resources for specific topics that might be related to the plan of enhancement. If you have questions, contact your assigned DDD program specialist for further guidance. All program specialists have received this exact same overview in addition to information regarding what they should look for, the content they should be looking for, and how they can provide that recommendation and technical assistance to providers upon review of the plan of enhancement.